Good afternoon, everyone, and welcome to the Government of Anguilla's virtual press conference. This is the third press conference for May, and we have a packed agenda for this afternoon. We will be keeping it as brief as possible. We don't want to waste your time. We want to ensure that persons are able to go back through the live if any information is given that they want to recap on. So we will be going through the list quite quickly. I'd like to start with a word of prayer, and then we will move on through the agenda with a minute of silence. So if you join me in this prayer. Thank you, Heavenly Father, for allowing us to gather here today in this virtual forum. Thank you, Lord, for giving us the gift of life. And Father, though we face difficult times, I pray that you empower us to be our brothers and sisters keepers. Lord, I pray that you assist us in communicating with our people and reaching our people. Dear Lord, we are merely flawed humans enlisted to your service, trying to do your will. Enable us by your grace to lead this country in the right direction. Lord, in this moment and around the world, we pray for all who are ill, those who are facing difficult circumstances and tough times. We pray that you will continue to be the same God now and forever to every one of your people. In Jesus' name I pray, amen. At this moment, we are going to have a moment of silence for the former Chief Minister of Anguilla, the Honorable Hubert Benjamin Hughes, a true patriot fighting for Anguillians both here and abroad. So please join with me in a moment of silence. And now we will have the opening remarks from the Honorable Premier, Dr. Ellis Lorenzo Webster.
Good afternoon. It's a pleasure again. Just hold 1 second. Let me turn this down. Apologize for that. I have two computers going at the same time. I just wanted, to thank you, Minister, for that moment of silence for fallen patriot. God certainly, knows that he has been through a lot, fought a strong battle, and he has called him home. I want to thank him for his service and thank his family for lending us to this country of ours for so many years, where he toiled on the battlefield to get Anguilla progressed to where we are now. And so I want to say that, I owe my political career to him and to his leadership and his guidance, at times admonitions, and certainly, want to say that Anguilla, has lost a hero. So thank you for that opportunity. Today, we continue with the press conferences to update people of Anguilla regarding COVID status and cluster, and the health team will give updates on that. I just wanted to say I've been getting a lot of questions from persons about medical underlying conditions and the effect of COVID, and also whether they can take the vaccine. And so I'll start off by saying that everyone 18 years and older can take COVID-19 vaccine, except those who are allergic to the ingredients or who are pregnant and have some medical condition that would contraindicate it. And so those are, there are very few who are not, who cannot take the AstraZeneca vaccine. Certainly, the Centers for Disease Control, the World Health Organization, Public Health UK have all said that widespread vaccination is a critical tool to help stop COVID-19 pandemic. And the same thing here in Anguilla. That is what it will take to get us past this pandemic, is widespread vaccination. And we talk about 70% of the population being vaccinated as an indicator of herd immunity, which would mean that if we have 70% or more of the population vaccinated, the chance of someone who has the infection passing it on to somebody who is not vaccinated is very, very small when you have those are surrounded by vaccinated persons. And we have to think about children who cannot be vaccinated, pregnant women who it was not studied enough on, and those with medical conditions where who cannot take the vaccine. But there's many, many medical conditions, and it is recommended that persons who have underlying medical conditions get vaccinated because those are the most vulnerable. Those are the ones who will end up hospitalized on a ventilator or dying if they get infected with COVID-19. And so this applies to persons who are immunocompromised, those with HIV, those who've had kidney transplant, other types of transplants, they can all take the vaccine. Autoimmune conditions such as lupus, arthritis, scleroderma, other autoimmune disorders can take the vaccine. Cancer, chronic kidney disease, diabetes, Of significant importance, those with chronic lung disease like asthma, COPD, emphysema, those should take the vaccine because those are the ones, if they got infected, who are at highest risk that they will not make it. Heart conditions, diabetes, obesity, sickle cell, those who smoke are at higher risk if they got infected to having severe disease and to end up on a ventilator and maybe not making it. Persons with stroke, those are all. So essentially, just about everybody, unless you're allergic to the ingredients in the vaccine or you have one of the rare medical conditions where you are contraindicated to get the vaccine, or you're pregnant, or you're under 18 for AstraZeneca, everybody else can get the vaccine. And just want to say that, this is World Lupus Day, and so we want to, say for those who have that debilitating disease, we, want to basically say we wish you well. And we certainly know that there are persons Anguilla with lupus. There are persons Anguilla who have had lupus and passed, and those who have it who are living with it and struggling along. And we do wish God's blessings and healing upon you. And then I heard it's Nurses Week also, and we know that nurses are frontline, have been doing the work. I always said that the nurses are the most important part of healthcare service because we doctors we give the orders, and the nurses are the ones who take care of the patients. So except the CMO, of course, she has to be in there, getting hands dirty, trying to get us through this pandemic. So we thank you, Doc, for that. And so basically, we're here today to continue to get the updates, to know where we are, and so you can ask the questions. We are very approachable, but I want you to know that this is one of those times which will determine Anguilla's future, and I don't say that lightly, because history will show that the health team has done a mammoth task of getting Anguilla to this point where we are essentially safe. We have the cluster still, which is something we have to be concerned about because we don't know yet that we have, gone past it. But certainly we are working in that direction, and by staying home and following the protocols and the regulations, people of Anguilla have helped to stem the spread of this virus from the cluster. And I want to thank you for that from the bottom of my heart. And those of you who are getting vaccinated, I want to thank you for doing that also, because that gives us the opportunity to protect our health, protect the health of those around you, and to get Anguilla back to a state of normalcy. So I want to thank you for this opportunity, and certainly we'll talk more.
Thank you, Premier, for that opening statement, and thank you for bringing awareness to today being Lupus Awareness Day and Nurses Week. We know that we have many thanks to give to the nursing and the health team at the Ministry of Health for all that they're doing to keep us safe at this time. We're now going to move to the COVID-19 cluster updates from the CMO and the PS of Health.
Okay, good afternoon, everyone. So on this Monday, we have some new things to report. Last time we gave an update was current up to the afternoon of Friday, 2:15, when we had the sequencing information from the cluster. As of today, May 10th, and at that time we had confirmed 65 cases locally from the cluster. Today we're up to 76 cases from the cluster detected locally. In addition to that, we had 2 persons walking at midday from a same household that tested positive and are under investigation. So the team is now doing the follow-up and so on to see they're linked to the cluster. But we'll see at a minimum that this is a slight expansion of the cluster. And I'll tell you why. Because as of 2:16 on Friday, when we spoke about 65 cases, Over the weekend, Friday evening into Saturday, we received an additional 11 positives, but these were household contacts. These are 11 positives spread amongst 4 households. So that was not surprising in the sense that, that's the most high-risk contact. And again, it reinforced the reason for us saying we tested persons, they were identified as contacts, and we've said they have to be quarantined while the case identified in the household was supposed to be isolated. So that did play out. We were not expecting, we're not happy for the climb in cases, but it was not a deterioration of the situation, as it were. So 11 more cases across 4 households between Friday evening and even up to this morning. Most of those persons, you can see from the results that they're more or less recovered. And most of the persons originally identified in the contact in the cluster, 49 of them are also considered recovered. So at the time of writing now, we're up to 109 confirmed cases, 87 recovered, and 22 considered active at this time. That is after having screened more than 1,460 persons since the 21st of April. As we said before, of the 3 persons hospitalized, 2 have gone home and 1 is scheduled for discharge today. We noted last time that we're dealing with a variant of interest. Let me get that long name for you. The lineage is B1.526.1, and it's a variant first discovered in the US. So it's a variant of interest, not a variant of concern. And we said the main distinguishing feature is that with the variants of concern, you're already seeing worrying patterns with regards to bigger outbreaks, more hospitalizations, more deaths, and very worrying questions as to whether your vaccines will be effective. So we're not dealing with the UK variant, the variant discovered in the UK. We're not dealing with the variant discovered in South Africa. We're not dealing with the triple mutant variant that's wreaking havoc in India, and so on and so forth. So we're still good on that score. I'm going to pause now for any questions. Oh, you said at the end, sorry. So with regards to vaccinations, we continue to see an increase in terms of uptake and registrations. We're now 8,339 persons registered. Of those, 7,699 have received their first dose. That's 61% of the target population. We want to reach 100% or close to that of the target population. So we're at almost, 7,700, and that information is not current up to date just because we have to put data in at the end of the day. So that number will increase by the end of today. So we have 7,699 persons having received a first dose, and 3,638 persons, almost 30% of our target population, having received a second dose. So I'm going to pause it there and ask PS to continue.
Thank you very much, Chief Medical Officer. I really won't make too many remarks at this point in time. Simply to say that on behalf of the Ministry of Health and our staff here, we'd also like to extend condolences to the Hughes' family, to former Chief Minister Hughes, who certainly not only as Premier, but he was also Minister of Health for some time as well in his last administration, as you recall. So the staff here would have worked directly with him. And of course, you would have worked with him before in the previous administration as Chief Minister as well. So on behalf of the staff here at the Ministry of Health, the Health Authority, we'd like to extend condolences to the Hughes family for the work that Mr. Hughes has done in his many, many decades of service to the people of Angola and to the people of the region. Certainly as a stalwart in regional unification and regional work here as well. Just in terms of vaccination, we'd just like to say this morning was a very good morning for first doses. Up to midday, they're already given 170 first doses up to midday today, and I'm certain by this afternoon that will certainly be over 200 first doses. And we want to thank the people of Angola for, raising and rising to the call and coming out to be vaccinated. It is the major plank. It is a major policy of the government right now in order to get us back on a sound footing. So I want to thank those persons for coming out this morning, for getting their first doses, and we ask others to come out as well. Thank you very much, Minister Options.
Thank you, CMO, and thank you, PS of Health, for your continued work and your surveillance of the COVID-19 cluster in Anguilla. I just wanted to go back and reemphasize something that the CMO said. She spoke about 76 cases from the cluster, and the fact that part of that came from an additional 11 cases. But she also emphasized about 22 active cases. So there is a question whether or not you can explain what you mean by 22 active cases, very briefly.
Okay, so the number we gave, which were at 109 overall, 76 from the cluster and 2 under investigation because they just walked in and we're doing the work, the surveillance and contact tracing. Those are confirmed cases. At some point in time during the evolution of the infection, persons are expected to have recovered. This is after having spent upwards of 10 days in isolation. We are still using a 14-day benchmark, even though the UK and the US would have dropped theirs to 10 days with a less than 2% risk that person is still infectious. So over 10 days of isolation, they're no longer symptomatic for the preceding 3 days, and that's with or without testing. We also test, and the testing gives us a good idea of infectiousness. So those things together is why we can comfortably say when persons are recovered from the infection.
Thank you, CMO. We now have I know there was a lot of concern in the community as it relates to persons with chronic illnesses and chronic diseases with COVID-19. And we have someone who has a chronic disease or chronic illness who wants to kind of give some information to the public in relation to that particular aspect. So we have Mr. John C. Lake for a moment. You can start.
Good afternoon, radio listeners. I would like to thank the Honorable Premier and the health team for inviting me here. My name is John C. Lake, affectionately known as POW. I represent the Anguilla Community Action Network to support persons who is living with chronic disease. This afternoon, I'm glad for this privilege to share some updates. But before I share that, I would like to send a special condolences to the past Chief Minister, the Honorable Hubert Hughes, or condolences from the Anguilla Community Action Network. This afternoon, I want to highlight, I've listened to a lot of things concerning vaccines. I too has taken the vaccine, the 2 doses. I have 2 underlying conditions. Living with HIV, 27 years, and also a cancer survivor for 13 years. I am here to encourage all persons with underlying conditions. And these underlying conditions come with good nutrition. And it's so much has been said about persons with chronic disease. But one of the things I realized that persons has been influenced by social media, what they hear, and not thinking of themselves in terms of their health. But I want to encourage all those persons out there with chronic disease. One, if you're in fear, check your doctor. And after checking your doctor, then you can make your decisions, but do not do it on your own self. So I'm saying to all these people here in Anguilla who listen to social media, I listen to people, all the critics and everything, but we need to push them aside. We are so grateful to have free vaccines, while other West countries is crying for the same vaccine that we are taking. So I'm here to encourage all the people of Anguilla to take the vaccine because it's very important. And I think that one of the things that Anguilla is not experiencing, yes, we heard about 3 persons hospitalized, but we're not facing the heavy impact of the disease. We're not seeing anybody lying down on the floors, anybody's dead. We're not seeing that. And I think that that is what we're waiting to hear. But I want to say I have to congratulate the health team because they were well prepared in terms of giving it a good service and the untaxed with contact tracing. And we have to realize we have to blame ourselves. And for blaming ourselves, this is where we come to in terms of cluster. And the health team is out there telling you all use all the necessary things that you can do, but we need to follow the precautionary steps. So I want to thank you all for
Thank you.
the tips.
Thank you so much, Paul. Thank you for your intervention. We're going to move on just because we know that we have a number of persons and some questions and answers, but we're going to move on to the Commissioner of Police for his update in terms of policing and enforcement.
Yeah, good afternoon, everyone. It's a little bit like the last few days, really. It's been a fantastic last few days in the sense that everybody's been really compliant, so we'd like to thank everybody for that. Yesterday, in the last 24 hours, we did 6 land patrols. We've done 2 vehicle checkpoints. We have stopped a total of 23 vehicles, and we've had no specific breaches, which is really good news, and partly due to the slightly relaxation in the regulations. Really good news. We've had 3 sea patrols, and we've had no sightings of any boats coming into our waters again, so that's really good news as well. And again, on behalf of the Royal Anguilla Police Force, again, we'd just like to extend our condolences to the Hughes family. Really sad news. I know he was well respected amongst the staff within the RAPF. And that really concludes my update for today.
Thank you very much, Commissioner of Police. That was very succinct, and we appreciate that. It's great news to hear that the people of Anguilla are doing their utmost to abide by the regulations. We do have a question coming through. We are moving now to the question and answer segment. We have a question from the Anguillian, and I'm going to allow them to ask the question now.
Good afternoon, James Harrigan here from the Anguillian. Would like to say condolences, deepest sympathy to the Hughes family on the passing of our beloved Chief Minister, Mr. Hubert Hughes. I have 2 questions in particular for the Premier. I'll ask them in one go. The first one is that the Premier mentioned 3 inhibitions that are allowed for people not to take the vaccine. The first one being pregnant women, the second one being under 18, and the third one, he said, if you are allergic to ingredients of the vaccine. Now the question is, can we tell with certainty what are the ingredients of the vaccine? The second question is this. Premier, I received a call recently from a friend of mine who said that one of our colleagues refuses to take the mandatory vaccine when it becomes mandatory. Her objections is not due to health reasons or religious reasons, but she feels violated, as she says, in having to inject something into her body which she does not feel comfortable taking. She even laments over the prospect of losing her job, and she's quite depressed over all of this. What response would you have to someone like this? Thank you.
Thank you very much, Mr. Harrigan. And those are good questions. In terms of the ingredients of the vaccine, we certainly, if you look it up, you can see what's in it. Most of the time, what we mean by that is if you've had a vaccine before and you reacted to it, an adverse reaction, most of the time that would be something we get anaphylaxis, have trouble breathing, or then that would be a person who we'd not recommend to take the vaccine. Other than that, there are very few persons who would react to the vaccine adversely in that way. Even we talk about the person's a very rare chance of getting a blood clot. Again, the chance of that is so rare, and it's you can't predict beforehand who would get it, of course. But given that the numbers are so small that would get that, that would not be a contraindication to not take the vaccine. In terms of the person who said if this is mandatory for frontline workers and that person is a frontline worker, then we would say, the goal here is that we want to make sure that we get enough persons vaccinated so we have a safe community. And you said that the person does not have a medical condition that would contraindicate does not have even religious convictions that would prevent. It's just principles stand. There is no right to work. And so if an employer decides that that person, cannot be, in near contact with persons, whether it's persons from the public or visitors coming in, say in the hospitality sector, then they can try to find a job in the back of house. And if that's not possible, then, again, there's no right there that, that the person would have if that is the choice they make. And so certainly that's a choice. You choose not to do it, but that doesn't mean that an employer has to put everybody else in jeopardy, because there is a risk to a person who's not vaccinated getting infected, themselves getting sick or transmitting the virus to someone else who cannot get vaccinated. So that person would not have that choice because they can't be vaccinated, such as a child or a pregnant person, and you are choosing that as an option. So that's all I can say about that. I would say, we'd rather not have to mandate things, but certainly when it's necessary in a pandemic, the Public Health Act does allow, for specific sectors, especially persons who would be coming in contact with persons where the risk is high, that is allowed. And the Constitution also allows that in a pandemic that the Public Health Act takes certain precedence. I don't know if the Permanent Secretary of Health has anything else to add to that before, but that is the position.
Thank you very much, Premier. I just would touch on some of the ingredients in the vaccine, and I would implore people to look it up. It's not something that's out of the extraordinary. In particular, with regard to the AstraZeneca one, it's a modified adenovirus that we use all the time to get a genetic code into of the spike virus, spike of the coronavirus, that you can elicit an immune response. This does not in any way go into your DNA, does not in any way change your DNA, it does not go into any nucleus of any cells. All it simply does is introduce the spike protein genetic code so that your body can elicit a response to it. So that when you do see the real virus, then you're already primed, your body's already primed with T cells and certainly other antibodies to attack the virus, so that it doesn't have a chance to multiply in your body. So I would ask everybody to look it up. The ingredients are there online. You can just go to AstraZeneca website and you can find what they are. Straightforward.
Thank you, PS. Thank you, Premier. We're going to have two questions from the media, and then we're going to get one from Ms. Hennis. So the question was asked, can you tell us, and this is to the health team, can you tell us the treatment procedure for dealing with COVID-positive persons that don't have a compromised immune system? And how have persons been recovering who are not vaccinated? It's two questions.
First of all, we had the the supportive treatment, including dexamethasone, quite fortuitously. That is an old drug, an old steroid that has been seen as a game changer. Luckily, we had 3 persons with that degree of respiratory distress, and so we were able to manage. The health authority colleagues were able to manage them comfortably, and they are just about the last person is going to be discharged from the hospital. The other persons are recovering nicely, and that is a blessing. I think once again, Anguilla is blessed, but this hinges on a couple of things. Remember that if we continue with this epidemic situation, we right now in Anguilla are fortunate that this cluster did not involve any of the variants or mutations out there that will cause severe disease and death. Other countries are grappling with that, 1. Two, the crux of the matter why the vaccination has become so much of an exit strategy for the world is because it is known if we continue to have this virus continue to mutate all over the world, we will be increasingly faced with the prospect of more and more deadly variants. So that's extremely important. So yes, we've dodged yet another bullet for the time being. So it's also critical to look at the type of strain that came in this time, and to note that it's almost like a ticking time bomb. We don't know when these things are going to be introduced. Right now, we got a word out of India that is a triple mutant. Triple mutant, what's that? So that's the most recent feedback from the WHO. The understanding is that once viruses are allowed to mutate, then they will do so. That is why it's so important for us on a global level to get this thing under control. And it's going to be a combination of vaccinating and a combination of the public health measures until you can vaccinate. So we cannot allow this virus to keep mutating and moving around as it has. And that is why it is so critical for the vaccination at this point in time from a health perspective, as well as the constraints on the economies. So we need people to bear that in mind as well.
Thank you, PS. One other question we have is, maybe this is for the Commissioner of Police in relation to our update on the illegal entry, whether or not anything has been received from St. Martin.
I said at one of the previous conferences I've done, we're going to leave this alone until the health committee, the health department here have the time to spend with us. And then obviously, again, we have to respect people's privacy and their right to have that medical information kept private. The MLA, which is the letter of authority that's given across to St. Martin to allow us to access some CCTV, I understand that's been signed, but I'll check that. I understand that's been signed to be able to allow us to get some information. And again, the third part of this was really asking people to submit information to our confidential email line, because we have information rather than intelligence that people have potentially breached these borders, and that's been going on for a while. But what we don't seem to have, we have rumours rather than people coming forward to tell us. So that's why it's so important to have that confidential email line and people sending us information, which is www.gov.ai/911. That was www.gov.ai/911. And it is this situation really where the public have the information, the public choose not to give us the information, and as a consequence, there probably have been some breaches of those borders. But the public do know who those people are, and they've not come forward and given us that information. So we will do the inquiries. The information will be treated confidentially. We will pick when we think it's the right time to have a conversation with the health department to see if they can release any information. And we will pursue the inquiries within St. Martin. But the most information that's available about this, and I think the Premier, the health team, etc., have stressed just how important it is to make sure we keep the borders tight and safe whilst people are being vaccinated, and the vaccination rates are too low at this point in time to make people feel safe. But the most amount of information that people have about these breaches is within the community, and people quite simply are not coming forward. So I'd appeal to anybody who has that information. We will certainly complete any investigations we have, but people have to, again, be willing to give us information or the facilities to gather that information to be able to complete those investigations. But rest assured, as you can see on the daily briefing, the previous daily briefings, you know, we will pursue people if we can, but that does rely on evidence and does rely on the support of the local community. And I say again for the third time, that's where the information is. So if you have information about this, and even if you believe in the future that as this process starts to slow down, people are breaching those rules and regulations, please submit it to us and we will definitely follow it up.
Thank you, Commissioner of Police. We have a question from Ms. Hennis from the Radio Anguilla.
Good afternoon. My question is to the Minister of Education. We know that the schools are due to reopen on the June 1st and even later in March for exams. Could you tell us what procedures or protocols are in place for students returning to school?
Thank you for that question. There is going to be a staged approach, and there's going to be an education update following shortly. Schools are scheduled to reopen. We have the go-ahead from the health team, but the education team is also working on some guidelines with what that will look like. and we will update the public when those protocols have been finalized.
Thank you.
I have a question from Brenda Carty.
Good afternoon. Yes, I want some clarification in relation to restaurants. This week, people who are fully vaccinated can go and sit down in restaurants. Many of the restaurants are still doing takeouts, but there seems to be some discrepancy about timing. For both these events, is the time 4 o'clock, 6 o'clock, or later?
At this time, everything still closes at 4 up until the 14th of this month. Everything closes at 4. 6 o'clock is to allow people to get home, finish their work. If they finish dining, if they have to close up restaurants, close up shops, you have that 2-hour period to get home. 6 p.m. is when the persons are required to be at home, but certainly we are requiring that at this point in time that all facilities close at 4.
Thank you.
Thank you. Thank you, PS. We have a question from radio. Another question from Ms. Hennis. Saw the hand. The hand's still up, or is that an old hand?
Oh, sorry. Yes, I wanted to ask a follow-up question pertaining to what I asked on the reopening of schools. I know last week one of our colleagues asked about whether teachers are considered to be on the front lines, and Mr. Rogers said yes, because they're dealing with a large group of vulnerable people, I guess, children. I'm just wondering, are teachers required to take the vaccine?
When we get to the regulations, we will be able to update the public as to what sectors are identified.
Okay, thank you.
The PS might be able to give any further explanation.
No, at this time, the answer still remains the same. Once we're dealing with vulnerable groups, we will expect people to be vaccinated. At that point in time, we'll give more details on this.
From the Anguillian.
My question is also related to education. For the past weeks now, we've been on conferences with the COVID-19 issues. When school reopens, would there be a social distancing in the school? Will children be required to wear masks like they're doing now? And another thing is there any plan for the health reform in schools, or education process for health reform for the children in the school that youngsters can benefit from for their health in the future?
I'll attempt to answer the first question, which I think touches on what are the protocols that will be in place when schools or if schools are asked to reopen. And those are what the health team and I are currently working on in relation to what it's going to look like. Obviously, I know that people are waiting for answers and we will be able to come to them, but we want to make sure that we can finalize everything before we publish them so you know exactly what is requested. As it relates to health reform in school, I'm not 100% sure what you mean. Could you explain?
An education program to enlighten children on the benefits of health practices, public health practices, and to provide a prevention against things like viruses and so on.
Well, I would say that's a standard practice. That's part of every curriculum, and that will continue to be reinforced, certainly. But just to concur with what the minister said, everything is going to depend on how this evolves and the epidemiological situation in a few weeks. So it's hard to project into the future. We can only hope for the best, but prepare for the worst. And everything will be dictated by the epidemiological situation at that time.
Okay, thank you very much, then.
Thank you. We also had a question about to the Premier about why are the churches closed at this particular point in time.
Thank you very much for that question. The we just we are still in a cluster, which is a public health emergency, a crisis, and it was necessary to keep people away from each other, because we didn't know the extent of that cluster, and we're getting a better handle on it now. But still, it is still possible for there to be persons who are positive infected out there that we have not isolated, and that's because some persons may have been asymptomatic or didn't come in to get tested. And so we have to still continue to contact tracing. Even these new cases, even though we feel that they are part of the cluster, we still have to know where they've been, who they've been around. And so we want to reduce the chance of persons coming into contact with someone that they could have gotten and infected by and then spreading it. We do know, and the PS will say, that, back in Washington State, there was in church, there was a choir where one person went in and infected 58 persons, and that basically spread like wildfire. So, and at churches you're singing, so it's not like you're quiet, you're hiding behind a mask, and so this is what we're trying to avoid right now until we get this under control and we know the epidemiology of it, and also the extent we will need to continue. And as we had said earlier, we want to have 2 incubation cycles so that we can basically burn out any of the COVID that may still be out there.
Yes, certainly. And as the Premier said, this is really about mass gatherings and mass gatherings in indoor spaces, which are particularly high risk. So we're beseeching persons to look at it from the scientific point of view and not too much attribute. We're not against church, certainly not, or anything like that. It's just about indoor mass gatherings, which have been proven to be the most high risk type of gathering. And in addition to some of the aspects, you tend to produce more what they call aerosols, more infectious particles by singing, by talking, by closed spaces indoors. So we're just trying to be extremely careful. We see where this virus can go with just a slip. So we're just asking people to be patient. It's just a couple more weeks. Let's see where we are, and let's work through this together.
Yes, certainly. I'd like to add that as well. I mean, it has been proven. If you look at the CDC information, if you look at information that we get on a daily basis from the US, churches have been deemed as places for a super spreader event. It's close-knit. We sing, we hug each other, we welcome each other. It's very difficult to do those things and not spread a virus. I mean, if you look at what happened in the US over the last few months, in November of last year, there was this church, this special denomination that had 3 different campuses in San Diego, and they spread it like wildfire. 64 cases with 3 outbreaks. In North Carolina, in December of last year, this church spread 200 people. It was just spread wild throughout the congregation. 20 persons and 12 died. In Massachusetts last year as well, there were 36 cases, 36 clusters from churches, 316 confirmed cases, and certainly that spread through the community as well. And Mount Vernon, Washington State, in terms of what the Premier spoke about, this one person in a choir spread it to 52 persons in that choir in March of last year, and then 2 people died. So the CDC has always advised that it's very difficult to social distance in churches, and even if you do social distance, the way you sing and you pray and you say hallelujah and you on the top of your voice, sometimes aerosols can spread, this droplets can spread very quickly and very far. So we are not doing this out of a need to have churches stop. We're doing it out of a need to break transmission, to ensure that based on the scientific information we have, to ensure that we try to get a handle on this. And it has been shown that these viruses can spread very quickly through congregations.
Thank you, PS, Premier, and CMO. We have one other question which relates to tourism, which was asking about the visitor portal being operational and whether or not when it's going to be up and running.
So in terms of the visitor portal, we are working on that right now. And in fact, I spoke with the deputy governor today, and it should be up this week. We are switching over to where DITES, Department for Information Technology and E-Government Services, will be setting it up and getting it managed. And so, yeah, so just to, assure the hospitality sector and the community that we are working on that. It will be up. The plan is this week, and we will be taking bookings. That's registration of persons who are applying to come into Anguilla for the 25th of May and onward.
Thank you, Premier. So we have gone through, we have one more, is that an old hand I see from the Anguillan? I'm going to entertain one more question, and then we're going to go into the closing remarks. I'll ask the Anguillan to ask their question at this point in time.
Yes, thank you, Minister. The question that I have is actually related to a news story that came from the Irish Times. I don't know if you are aware of it, but the Irish Times have said that many countries have been allowed to come to Ireland without quarantine. However, it says passengers arriving from the state of Nepal and Anguilla from Wednesday are required to enter mandatory hotel quarantine. Now, is it a possible mistake, or is it? How do you defend that?
No, I haven't been alerted to that, to be quite frank, so I would have to look into that. It would be very strange for us to be the only 2 countries in the world to be on that quarantine list. That would be a bit bizarre. So I would really look into it, because if you're looking at cases and community transmission and variants and so on, we certainly would not be the only 2 countries that would be on a list such as that. So that's hard to comprehend why only those countries were mentioned, if that were the case. So I would really have to look into that. That hasn't been brought to my attention before today.
We were wondering if it was Angola instead of Anguilla, because sometimes those 2 country names get mixed up for chance.
Even so, given what's going on today, that's a very strange list. So I really want, we'd have to look into that. It's a strange one.
Okay, thank you very much.
Thank you, CMO. And thank you for everyone for listening. We've had a session as we continue to keep you informed about COVID-19 and the cluster. As you know, a lot of the protocols that are in place are simply in place to protect us. They're not something that we want to have in place forever. Although we know that the changing nature of COVID-19 is changing the way we do things here in Angola and around the world. We want to, and we have to be able to balance the health of our nation and the need of our people to have an economy that works. But of course, our emphasis has to be on making sure that everybody is healthy, because if you're ill and you can't work, we want to be able to prevent people from being ill. So at this point in time, I'd like to move over to the Honorable Premier for the closing statement.
Thank you very much, Minister, and for moderating today. It's the beginning of a new week, and certainly the update with the more positive cases is, it's a little concerning. If there's any good news, the news would be that it is persons that we already were in quarantine, and but this disease is one that can cause severe long-term effects, can cause persons to become hospitalized, can even cause them to die. And so we need to take this all seriously. And I know there's pushback on the vaccine from some areas, and I try my best to say, that this is the only way that we can get through this, get vaccinated, follow the protocols of the hand washing, the mask wearing, and also social distancing. And, it's not hard for us to do these things. I mean, in the UK and the US, they've been following these protocols now as for, almost a year and a half. We have just been doing it for we are in the third week now. And I'm just asking that people be patient, trust the science, trust the epidemiology, the public health, that we are doing what is necessary to keep you safe and to save your lives. And, it may be inconvenient, but it's certainly death is not one that we want to deal with. Again, I want to say thank everyone for coming, the media, the Permanent Secretary in Health, the Chief Medical Officer, Commissioner of Police. I want to thank John C. Lake Powell for his testimonial, because, as I said, he has 2 chronic diseases, and he would be in the category, and age-wise also, where he has a higher risk of having severe disease, becoming hospitalized, and dying if he was to get this. And he has done the responsible thing and gotten vaccinated. So we all should follow that example. He was one of the first to get vaccinated, and I know he was there on February 5th, just like the rest of us, to do it. And so I want to thank you again. I want to wish condolences again to our fallen hero, the late Honorable Hubert Benjamin Hughes. I want to say condolences to his family, to our Minister of Infrastructure and Tourism, the Honorable Hayden Hughes. He's lost his father, he's lost his mentor, and so we want to, hold him up as he goes through his time. His brother Greg, and also his mom, Teacher Norma. She has been there through thick and thin, through the good times and the bad, and I want her to know that, whatever she needs from us, we are here. Thank you again, and I wish everyone stays safe, stay home, and let's get through this, and I know we'll come out better on the other side. So may God bless you, and may God continue to bless Anguilla.
Thank you.